Jan Lowery is presenting an ECCO deep dive, practical applications. And Dr. Lowery is a cancer epidemiologist and public health practitioner with broad expertise developing and implementing community-based programs in Colorado to reduce cancer risk and improve outcomes. She has worked closely with community partners in the state and at local level to integrate best practices for cancer prevention in both public health and clinical settings. She's an assistant director in the Office of Community Outreach and Engagement at the Cancer Center and professor in the Colorado School of Public Health. So thank you so much, Dr. Lowery, for being here with us this afternoon. I will turn it over to you now.
Thank you, Tim, for that very nice introduction, and thank you everybody for attending today. I'm going to share my screen, see if this works. Okay, a thumbs up, Tim. I got the right screen here. Okay, very good. So I'm here today to talk about our data platform, which is called ECCO, Exploring Cancer in Colorado. This was a product created through the Cancer Center Office of Community Outreach and Engagement. And I have just a few slides today just to provide some background and overall purpose of the ECCO platform. But actually, most of the talk I'm hoping to just walk through the platform itself. I think that might be most useful. So my objectives today are to, again, give you some background and the purpose of our ECCO platform, and then go over the content, at least the current content that we have in the platform, and the different functions that are available right now. Maybe go over some use cases with you all, and then talk a little bit at the end about what are some of the planned improvements and future directions. And as Tim mentioned, save time, ample time at the end for discussion. This is a platform where we're continually to evolve, and we would love to have your feedback on other things that you think might be useful to have in this platform. So just by way of background, a little bit about the Office of Community Outreach and Engagement. I've been with the Cancer Center for, goodness, over 20 years now. This office is relatively new. It's about 5 years ago, the National Cancer Institute came out and essentially mandated that all NCI designated cancer centers have this office. And these are our three aims that we pursue. And these are very common across all cancer centers across the United States. The first one is to monitor and disseminate up-to-date data on cancer burden, risks, and disparities in our catchment. The catchment is a new term too. All cancer centers were asked to define the areas in which they serve or intend to serve through their research and outreach activities. And for us, the catchment area is the entire state of Colorado. Our second aim is to facilitate community-engaged research across all of our 4 scientific programs, including our clinical trials work, which is where you all come in. And then the third aim is to engage communities in the dissemination and implementation of interventions on cancer prevention, control, and survivorship. And the ECCO platform, although developed primarily under aim 1, as we'll talk about today, serves all 3 of these aims. So a little bit more on the background. As I mentioned, I've been with the Cancer Center a long time, but joined the Office of Community Outreach and Engagement in 2022. And right off the bat, I learned about this new group called Catchment Area Research and Data Science, or the CARDS group. And again, I mentioned that all cancer centers were charged really with the same aims. And we all were at this point of trying to figure out what is our catchment and how do we characterize our catchment? What data do we have to do that? So this group was formed and I joined it. And it's a great group, a lot of data scientists, epidemiologists, public health folks, all coming together and honestly sharing information about what they're doing. It was a wonderful group in terms of just sharing ideas. Everybody was very inclusive. And then in 2023, I attended, it's called the Spatial Sciences in Cancer Control meeting out in California. And while I was there, a lot of these cancer centers presented these data platforms. And honestly, it was fantastic. And I was amazed at all the work, the great work that some of these cancer centers are doing. So I immediately came back and talked to our AD in the Office of Community Outreach and Engagement, put together a proposal for the executive committee for the Cancer Center to build our own data platform. So we got the approval and the go-ahead to do that. We started this project by vetting it with some of external contractors that build these types of platforms. And then I met with Dr. Sean Davis, who's a data scientist and informatics specialist, also an AD within the Cancer Center. And he said, you know, Jan, why don't we just build it in-house? We have the expertise, we have a team. Let's put a team together and build something here. So I said, great. So we established this multidisciplinary team, including data science, informatics folks, software engineering, cancer epidemiology, population-based science, behavioral health, and folks involved in disparities research as our core team. And we started by exploring the other platforms that were out there from other cancer centers, kind of deciding what we liked about them, what we didn't like about them. And then we began development of our own platform by putting together a proposal in terms of data content. What data do we want? Where can we get the data? What is the structure of the data? And then in thinking in terms of who are our end users and what are some use cases that we could use to help us develop the platform. We finally ended up launching ECCO, I think it was summer of 2024. And since then, as I mentioned, as I started, we sort of look at this as a living platform where we're continually seeking feedback. We're we're modifying different variables, different data points. It's really an iterative process, always to enhance the content, the utility, and really importantly, the user experience. So the purpose of ECCO, which is an interactive data visualization platform, is to help us characterize, again, that term, our catchment area, which is Colorado, in terms of cancer burden, risk factors, cancer disparities, and demographics. ECCO can be used to describe differences in cancer burden across our state, identify certain groups or populations with the greatest need or gaps in services. We use it to help guide much of the work that we do, the outreach work in our Office of Community Outreach and Engagement. It can also help communities understand on their own what the cancer risks and burden are in their communities and populations. We're just starting to look at how to use ECCO to reach or to track the reach of our research and clinical trials programs. I'll talk a little bit about that more. And in terms of research, it's really a tool that can help generate new hypotheses for investigators within the Cancer Center. The intended audience for ECCO, and this was an important distinction because some cancer centers have platforms that are internal facing. We very much wanted ours to be available to the community at large. So our intended audience is broad: community members, public health professionals, University of Colorado Cancer Center investigators and their teams, folks like you all, community outreach and engagement, and other stakeholders. The data content, and we will go through this a little bit more carefully, an important note, it's all publicly available. And that's really important. So it's sourced in a repository, if you will, in one place, and it makes it really easy for us to ingest it into our data platform. Some of the major categories of data that we have are demographics, both statewide and a county and tract level, cancer data on incidence, mortality rates and trends, some health behaviors, and cancer screening information, sociodemographic factors, some environmental exposures. And we also have information in there on locations and facilities to seek cancer care resources and services. So I think with this, I'm going to stop sharing. I could figure out how to get back to my screen here. Okay. Sorry, Tim, hang on. Okay, and I'm going to share my other screen here. Okay. Can you all see my screen with our data platform? Tim, is that a thumbs up? Okay. Okay. So, oh, and I should have left the, sorry, I meant to tell you, if you're at your computer, you can log on. It's coe-echo.org for those of you that at your desk or wherever you are today want to play along as we go. That's the URL to get to ECCO. So this is our landing page. And I just want to orient everyone to to where we are. So this is, of course, the state of Colorado. We have 64 counties. 47 of our counties are considered rural or frontier areas. The remaining are urban counties. The majority of people live in our urban counties. Only 12% live in these rural or frontier counties. So this is the map of Colorado. Over here is the legend, and here we're looking at total population across the state, and we have a scale that we use on every map that we have, and we have the source. Sorry, hang on a second. And you can move this around as you want. You can have it fit to the screen. You can do a full screen, which I click now, and you can sort of go in and out. Okay. Up to the right, I'll jump up here. We have the home page, we have the sources page, and if you click on the sources page, it'll list all the different data sources that we have. And this is continually updated. The nice thing about having this repository of data that we pull from is that data gets automatically updated as it renews over time. On our About page, it just tells you a little bit more of the map, how to use the map. And we also have information here on how to acknowledge ECCO. We also have a contact page to let us know if there's a problem or we have any questions or any ideas on how to improve the site. So I'm going to go back to the home page. We can dismiss this. Make this a little bit bigger and fit it. So if we go over to the left, this is all the sort of the data content area. We have data separated into geographic levels. We have 3 levels of data: county, tract, and health statistics region. For most measures, we have county level. For some, we have tract level information, mostly some sociodemographic information. And for a few variables, namely youth and adult vaping data, it's only available at the health statistics region level. Then we have something called measure categories, which is sort of this overarching categories. If we pull down here, they are listed here, a number of different things: sociodemographics, things about insurance, environment, a lot of social determinants of health information. The more cancer-specific factors are things like screening and risk factors, and we're going to look at this a little bit more. We have a cancer disparities index. We've added some exposures that are important to our catchment area on radon and ultraviolet light exposure and HPV vaccination rates. In terms of cancer burden specific information, we have cancer mortality, cancer incidence, and then we also have trends in mortality and incidence as well. Okay, if we go down to locations, what we have here are a number of primarily facilities that provide care. I'm going to come back to these right here, but mostly cancer care, although we do have information on primary care as well, where radiology centers are available, cancer support services, clinical trials. For example, if we were to click on where clinical trials might be across the state, if we click on that, it'll add dots to the map of where clinical trials are offered. If we then click on a dot, it'll provide the specific location and contact information for that specific site. You can click out of that. You can click more than one. If you wanted to get information on hospice care, for example, and where mammography centers are, you can populate more than one locations using this drop-down right here. Okay, so if we look specifically, if we start with sociodemographics information, again, this is the overarching category. These are then measures within this category. Here's all the different options that you have. So if we picked one, we're looking at total population right now. Let's pick maybe something Hispanic. Hispanics make up 22% of our population, and it is growing. So this shows by county the percent of residents that are of Hispanic origin. Here again is our legend with the source. If we click on a county, Mesa County, for example, it'll give us the value. So in Mesa County, 15.2% of residents are Hispanic. Down here in Costilla County, for example, it's almost 56%. You can also look at things like I'm doing a lot of outreach now to older adults in rural areas across the state. So we might want to look at where a high proportion of residents are over the age of 65. And you can see it's highly variable. If we look at our African American community, which is a very small community in Colorado, we can see that it's really limited to certain counties in our state. Okay. Other factors that we look at, I'm not going to go through all of these, just want to handpick maybe a couple to go through, is something called screening and risk factors. These are data that we source from that national repository, but the original source is from the Behavioral Risk Factor Surveillance System. And for those that aren't aware, this is one of our public health data sources that we use to collect information on health behaviors and risk factors, access to care. Almost every state in the country has this program. It's funded through the Centers for Disease Control, and ours is run out of the state health department. They collect information on a lot of different things. So there's more in here than is maybe directly relevant to cancer, but we could pick a couple of risk factors. So for example, if we looked at obesity rates, which is a risk factor for cancer, again, we can see that by county, the percent of residents that are based on this survey, which is self-report obese. Here's our scale. And we also, for many of these, have what the statewide average is. So the statewide is about 25%. If we were to go down to some of these southeastern counties, we can see that it's upward about 31%. So highly variable across our state. We can also look at things like tobacco, as you all know, a very important risk factor for cancer, and the differences that we see in terms of the prevalence of current smokers across different counties. We also can look, so these are some of the risk factors. We also have information on the Burfess survey on screening and adherence. And really now they're only collecting information on breast and colorectal cancer. We do have cervical cancer, but for some reason there's some glitch in the system at a national level. Otherwise, that would normally be here. We don't now collect much information on prostate cancer. As many of you likely know, it's not sort of the standard, it's not recommended routinely anymore. So the numbers are quite small. We hope to add soon lung cancer screening, which we just started collecting in our state last year. But if we were to look at breast cancer screening, for example, this is the percentage of women in each county across our state that report having had a mammogram within the last 1 to 2 years. And what's interesting, if we want to look, because we do this when we're trying to figure out where to do outreach, if we look at locations, we can overlay this with a couple of things. One, maybe, well, where are people, like in the southeast part of the state, you might say, why is it so low? Well, does it have anything to do with mammography centers? Well, it might, if we look at this. Certainly, it's not surprising that most of the centers are in the main corridor that we operate in, but you can see how disparate these centers are across the state. There's also a program that we work with very closely called the Women's Wellness Connection. They provide free breast cancer screening and cervical cancer screening in our state. This is our state's version of the CDC-funded program that most states have. So you can see that it sort of creates more coverage in a lot of these rural areas, but it's not everywhere. So there are gaps in services that we can identify that might be related to breast cancer screening, likely are related to breast cancer screening. We can also look at colorectal cancer screening. Find it. And I will say, we'll talk about this later, but one of the things we're trying to do to improve this is make this more simple. It's not very intuitive right now. We're creating more of a search tree, if you will, to make it a little bit easier to search on these various categories. But we can look at colorectal cancer screening as well across the state. Again, the state average is about 65%. It's higher in some counties. Let's see, where is Denver? About 61%. And it's lower in some of the areas, especially in the southeast corner of our state. So we use this information, for example, with COE, because we have a FIT program to provide free in-home colon cancer screening tests to sort of target areas in which we want to go and disseminate our FIT kits. Okay, in terms of other, I did want to show you, we looked at tobacco. I mentioned that there's a couple variables that are only available at a health statistics region, and those are our vaping data. We just recently uploaded these. We have a number of different categories, percentages of adults who currently use a vaping product. If you click on the health statistics region, it'll show you the average. And we also have this for our youth, which tends to be, vaping is, we tend to have higher rates than the national average for vaping. So we just recently added this. We and COE have a program, tobacco and vaping cessation program. I do want to note, because we're seeing here for the first time, when the boxes are grayed out, it means either there's no data, but most of the time, as we'll see with cancer, some of the cancer data, it means that the numbers are too small, so we have to suppress it. Okay, other risk factors that we have at a county level that are important for our catchment are radon exposure, because Colorado, I think, is among the top 10 states with the highest radon. We have the number of tests over the recommended level from the EPA. But what we like to look at is the percentage of homes tested that are higher than they should be. And again, it varies across the state. We use this information to help guide our efforts in our radon distribution program. In addition to radon, we also just added ultraviolet exposure, which is a significant risk factor for melanoma and other types of skin cancer, which tend to be higher in Colorado. Not surprising, there's sort of a gradient here by latitude. But this is one of the important risk factors that we have that's sort of unique, if you will, to our catchment area. Okay, now looking at some of the cancer incidence data. So again, we have mortality, incidence, and then we have trends in both. Incidence data is through state cancer profiles, which collects information from each state's central cancer registry. Ours is at the state health department. It represents the average over 5 years. So now our data represents cases from 2017 to 2021. Very soon it's going to be from 2018 to 2022. So as we get more data, we're going to expand. Not expand, but actually make it a little bit more recent. So for cancer, we have a couple other options. So this is showing cancer incidence by county. This is for all cancer sites. For cancer, we don't have all the different cancers, but we have the more common ones. So we can look at all sites. We can look at breast cancer, for example, and you can see how that differs across the state. Again, we're seeing these grayed counties, likely because it's not that there aren't breast cases there, but there's probably too small of numbers. So here's the statewide average of 133. If we click on, for example, Chaffee County, we see that it is above the state rate. It's at 141.8. The other thing I want to point out, though, is because we see some of these counties are really high, this one 141, it's also important to look at the number of cases. So for example, if we're looking at Denver, the number of cases is, what is that, 452. If we're looking at Prowers County, which is much higher rates, we're looking at 11. So it provides sort of more perspective. The rates are higher, but the numbers are going to be smaller, again, because these are less populated areas. So what we also have for some cancers, at least, we have, well, for all cancers, but for some, we have late stage, we have stage, we can do all stages. We can also do late stage for some. And this gives us some indication of where screening might be lacking. Women are being diagnosed, at least for breast cancer, at late stages. We can also look at a breakdown by different racial ethnic groups. This is kind of where we get a lot of suppressed data. We could go back and look at all cancers. If you wanted to look at just Hispanics, for example, give you some more data. We can also break it down by age, less than 50, 50 plus, or 65 plus. Colon cancer, for example, I know has been increasing in younger adults. So if we were to look at colorectal cancer, and other cancers as well, If we looked at all races, and then we wanted just to look at under 50. Again, there's going to be a lot of grayed out because it's not that common, but we see sort of this hot spot in Pueblo. So that's cancer incidence. We also have cancer mortality. Kind of the same options that we have. We can look at all cancer sites. We can look at certain subtypes. If we looked at lung cancer, for example, not many under 50. Just make sure that you use these toggles. So it just gives you an idea of different, the distribution of cancer burden across our state. We also have information on trends. And as I mentioned earlier, sometimes there's, some grayed out because of suppressed data. But if we look at all cancer sites, all genders, all stage, all racial, ethnic groups, and all ages, this shows us across Colorado whether, if I'm looking at the legend here, rates are falling, they're stable, or they're rising. So across the board, for Colorado at least, most of them are stable, and just down here in La Plata. And that can be for, this is just for all cancer sites. We can also do it by different types of cancer, for example, prostate cancer, which is increasing in La Plata and Route and a couple others as well. The other thing I wanted to point out that we have in here is something called a cancer disparities index. And we have an index for these 4 cancers: breast, colorectal, head and neck, and lung. This is a ranking, if you will, of counties based on a principal component analysis that looked at cancer incidence, cancer mortality, and the percent of cancers diagnosed at late stage. So the interpretation is the darker the color, the higher the rank, the higher the disparity index. We have one for breast cancer. We have one for colorectal, head and neck, and we have one for lung as well. Well, a pattern that we are commonly seeing is there's a lot of cancer disparities in the southeast corner of our state in terms of cancer burden. It's also an area that has high poverty and also an area that has a higher percentage of Hispanics living in that area as well. Any questions so far? So I hadn't intended on going through all of these. Maybe we can just look at a couple to get a flavor, maybe looking at insurance, for example, and looking at the uninsured, how they distribute across our state. The darker the color, the higher the percent of uninsured. Okay, I also want to talk a little bit about function. Let's just go back to cancer incidence, for example, and just look at all cancer sites. A couple of things that you can do just from the landing page. You can click here and download the map. It'll go right to your download file and you can print it off and you can use it for a paper, a grant, a report, even just to look at. We've intended for our some of our community partners to be able to print this off and use it for their own like public health planning, etc. You can also click here and actually download the data. Let me see if I could, tell me that you can see my Excel spreadsheet here. Can you all see that? Tim, thumbs up, yeah? Okay.
Right now we're still seeing the ECCO tool.
Oh, you are? Okay. Well, it's not going to switch over, but if you click on that, it will download all of the cancer incidence data by county. So again, this is not record level data. It's county level or tract data, depending on health statistics region. But it will give you all the different cancer types. And in this case, it'll give you incidence data. If it's for mortality, it would give you that. You could use that to create your own graphs at a county level. And this is for any measure that you might have visualized here. Another feature that we added, just going to go back to sociodemographics. And if you click on a county, in this case, Mesa County, again, sociodemographics, we know there's 157,000 people that live there. If you click on See All, we created something that we call county snapshots. And there's a basic snapshot, and then there's a more advanced snapshot. In the basic snapshot, we just created these graphs looking at just a select group of demographic measures, cancer incidence rates compared to the Colorado average, which is in green, the county, which is in blue, mortality rates, and then some select risk factors, the ones that we went over earlier on tobacco and obesity and physical inactivity, and then some information on screening as well, and then on trends. This is sort of a work in progress. This is our first attempt at trying to visualize some of these data at a county level. If we were to click on the All tab, now this provides a lot more information. Much of the data that's in our, in our categories is displayed here. In some cases, we provide the Colorado average, so counties can download this and compare it. We are working on trying to create or add in, if you will, all the different state values for these to make it more useful. So a lot of information here. Our intent was that county public health, local public health departments, other community partners could download this and have it at their fingertips, essentially. Okay. Back to this. What else did I want to cover? We did kind of go over these. Let's just pick a measure. Let's pick screening. Let's pick tobacco use. It's one of the areas that our office is interested in working more in is policy. And so we had actually a student at the School of Public Health work with us to help us create policy briefs that we started with adding in sort of lines to our ECCO that would allow us to delineate, what are the congressional lines or Senate lines within the state. So if we wanted to contact one of those representatives, we could do so and maybe share information about, hey, in your region, the rates of tobacco are quite high. So if you click on this, it'll tell you the district, the name of the representative, and the contact information. So it's just a different way we can use this visualization platform to help us with to do some of the work that we're doing. The other thing we just added was something called a compare function. So I'm going to use an example I had recently. So I was up in Steamboat Springs last month, and we did a research roadshow where we're bringing research teams from the Cancer Center and the Center on Aging to some of these rural communities in our state to bring research teams to talk about the research they're doing, and if possible, screen people on the spot and enroll them into these studies, clinical trials and other types of studies. So when I'm there, I come and I bring our ECCO tool. We have a big screen, and I just walk through information with people. And I was talking with a woman there who happened to be a reporter and shared with her, for example, let's look at cancer incidence and prostate cancer, for example, how high the rates are in Routt County. And she was very intrigued by that. So when I left the roadshow, she called me and said, Jan, we'd like to do a story on that. We'd like to use your ECCO tool. So her and I have been working, she actually published the article just yesterday, but I'm bringing this up as a sort of a use case of information she said, why is that happening? What might be explaining that? Some of the things we might want to look at, we can look at here, as well as there a difference in the age distribution there? Or is there a difference in the racial or ethnic mix? So if we use ECCO to kind of look into this, we can say compare. And I might want to add sociodemographics, and I might want to add over 64. I think I just did that backwards. Hang on. Now I'm going to go back to incidence and prostate. And I'm going to add that. I might also want to look at the distribution, the racial and ethnic mix, because Hispanics, for example, have a lower risk of prostate cancer. Could it be that fewer Hispanics live in that area? So I might want to go here and collect on sociodemographics and Hispanic. So we can look at multiple maps at the same time to help us maybe not answer the question as to why, but maybe give us an idea of what might be going on in certain areas. We also had a group that used this to look at radon exposures across the state, potentially, and we can look at that now, maybe would be of interest. Let's try that. So remove all. And then let's look at radon exposure, percentage of tests over the EPA recommended limit. And let's say we wanted to add to that lung cancer, for example. So we have them side by side to look at, again, not really an explanation, maybe hypothesis generating. The research teams could use this information as well. Okay, so that's our compare function. One other thing that I wanted to at least talk about briefly was how we use it within some of the things that we track within our Office of Community Outreach and Engagement. So if we look at just cancer incidents, let's just look at all sites for now. We go into the locations tab. We've added information on where we are out in the state. So all the different events that we go to. So for each red dot, there's a number in there. Kind of gives us an idea of our reach of the different programs that we have. This is for all events we go to. We also, as I mentioned, hand out fit kits. These are free colon cancer screening tests. Kind of gives us an idea of where we're heading. If we'd overlaid that around, for example, colorectal cancer screening rates, we use that information to help guide our activities or where we might want to target. We also have our radon kit program, which has been wonderful, a really statewide reach there. And we have our smoking and vaping cessation app as well. So this is just another way that we're using ECCO to help track, well, at least for the work that we're doing within COE. So let's see, I've gone through some examples, some use cases. In terms of future directions, one of the things that you all might be interested in is that we just got information from PRMS, Protocol Management, PR Research Management System, to add in information about, similar to how we were tracking the fit kits and the radon kits, where are our research participants coming from? How many are coming from rural areas in the state? How many from urban? What is the reach of our research program? So we're in the process of uploading those data, which is important for knowing where they're coming from, but also important for knowing where we're not. You know, there's some areas we might want to focus on as well. The other thing that we are, my notes here for a second, that we're hoping to add soon, as I just requested these data from the State Cancer Registry. You'll see here with cancer, we have stage, we don't have histology. And for some cancers, like breast, for example, and even lung, of course, treatment is related to histology. Research programs might focus on certain histology. We have a researcher, Matt Sikora, looking at specifically lobular breast cancer. So the ask to the cancer registry was, can we get county level percents, a breakdown, if you will, the frequency of different histologies for breast and for lung cancer. We've also asked for information on some biomarkers. So for breast, estrogen receptor, progesterone receptor, and HER2/neu, and for lung cancer, EGFR, ALK, and PD-L1, just to get information on across the state, what percentage of lung and breast tumors are being tested, one, and what percentage of those are positives. So we're just venturing on trying to upload some of this cancer registry data as well. And as I mentioned, the idea here, because it's a little cumbersome, admittedly, we're creating more of a decision tree to make it more easier and more intuitive to search. We think that's going to simplify this platform. And we're adding, because a lot of researchers have asked us to add a citation. So if you have this map and you wanted to print this, we would have a little feather here that would click on it, and then you would have your citation that you could put in your grant or your paper. So the intent really is to make this as, broad use, of course, for most people, enhance the content as we can, um, and um, and increase the user experience as well. So I think with that, I think that's all I was going to show you. You have the URL. I hope you play around with it. And if there's anything that anyone wants to open up now that we can look at together, or I can stop sharing and maybe just open up a conversation around what do you all think? And if you don't have feedback now, give it some thought. We'd love to have you just play around with it and send us a note, some suggestions. Or if there's anything anyone has a great idea about, hey, Janet, it'd be great if we had this. Is there any way to put this into ECCO? I'd love to open up the floor to have that discussion.
Great. Thank you, Jan. That was a really, I think, comprehensive and helpful demonstration of this platform. So yeah, if there are folks on the call that would like to put any questions that you have in the chat, feel free to come off of mute or raise your hand. We'd love to hear from participants on the call.
I can kick us off. Jan, thank you so much for being here and presenting to our group. Two questions that popped up for me as you were presenting. One was, so you mentioned one of COE's aims is to disseminate up-to-date information. I was curious because as you were clicking through things, I saw a few different sources of information that have different years associated with the data that's available. So I was curious, how often are the ECCO data sources updated?
Yeah, so great question. The state cancer profiles, I believe, is annually. So as I said, it shifts like in a year, it will have 18 to 22. There's a lag time with cancer registry data, so that's normal. The data from the BRFIS survey, which is stored in places, should be every year, and it's automated. But that's a great question, and we're trying to create a table in the sources page here, very easy to look at, and you know the source and the current years that we have in there in a citation. So one of the reasons we went with this system of having this open repository is that it's sort of seamless to us. I mean, nothing as easy as pushing a button, but it's kind of like that, where our data engineers have developed it so that it just constantly is updated.
Great. It looks like there is one question that came through in the chat. So is there any interest in getting into more detail on pediatric patients, meaning more concise age groups, adding to the disparities section, childhood cancer diagnosis, etc.?
Yeah, yeah, so great question. We do have, I mean, we just have this, right? Under 15. And the drop down, it's not by type, but there is a breakdown by age and then less than 20. So it's a little more rare. There's going to be a lot of, suppressed data. So that's a great suggestion. And, we have it's 5 years of data, which is helpful because then you can actually get estimates for small counties. The problem is, or the downside to that is you don't see trends, and things change over time. So, but yeah, that's a great suggestion. If there's interest on the campus to have more granular information, that would be helpful.
Excellent.
How about, oh, go ahead. There's a question.
Yeah, sorry, Jen. My other question is surrounding if you know of any other cancer center studies. I know you mentioned Matthew Sikora's lobular breast cancer interest, but I'm curious if there's any other studies that you've know of that have used ECCO to inform their research question or their grant proposal. And if so, can you speak to how that was used in those situations?
Yeah, that's a great question. I wish we had more of them. We're working on how to track it and, get people to let us know, hey, I submitted an abstract. We did have one from Maria Amaya. I think one of the fellows submitted one looking at radon and then AML, incidents of AML. So we know folks are using it. It's going to be a challenge for us to capture that, but that's certainly something we need to do. So I don't know if you have any ideas about how to best do that. Because you're right, people aren't using it, it's not helpful. We know our community partners are using it. We're getting some good feedback from them. When we go out to these events, I'm sharing it and people love it. So it's a really good educational tool, but we really want it to help our research teams too. And that's why I was thinking, let's get some other metrics in there, like biomarker data, for example. One way I think research teams might be able to use it is, we looked at, I don't know, let's just do lung cancer, for example. And then if we look at where people are getting care, see if I can say like medical oncology, for example. So if you were a researcher and you wanted to enroll folks living in more urban or rural areas, you could figure out how many people in Mesa, well, 101 per year. And what is this? This is a hospital. Maybe I want to contact them about recruiting some patients, so people can use it strategically about where are the cases occurring and who do I contact about maybe doing that? Because I know there's some talk about doing decentralized trials, which would be great. But if you don't do that, at least having a partner.
Lisa, I see
Lisa?
that your hand is raised. Do you have a question?
Yeah, sorry, I'm having trouble unmuting my mic. You mentioned that your community partners are using this. Can you elaborate on that? How are they using it?
Well, community partners, for example, in Steamboat, we partnered with them on a roadshow. So their local public health is again using it to like for education purposes to highlight, hey, there's a high need here. They have high vaping rates up there. I mean, they're trickling in, Lisa. This is going to be our challenge is making sure that people let us know, hey, I used it for this purpose. The ECCO is going to be the new state cancer plan is under review right now and actually open for public comment. I've worked on their data working team and made sure that this was made available to communities. They have a plan, but then they have an ECCO maybe to help plan their activities beyond that to address some of the stuff in the plan. So, yeah, Lisa, it'd be great to put this kind of stuff in our grant renewal. I know. So we're working on trying to get more information on folks and how they're using it for sure.
Yeah, I was just going to say this is an amazing tool, and we really need to spend more real estate, in my opinion, in this UCSG renewal on this, talking about ECHO and the potential it has. I know it's still pretty new. You said 2024 is when you guys launched this,
Yeah.
and yeah, there's just so much potential that we can talk about in there.
Well, we did just have that great article in the Steamboat pilot where, I was there educating, using ECHO to educate the people that came to our show, which is about 100 people. She wrote it up there. So I think slowly we can just get the word out and help people understand how to use it. The other thing I maybe didn't mention is on my to-do list is to put together a little tutorial, brief, just kind of a mini version of what I just did, of how to walk through it with people so that, people can use it and feel more comfortable.
And
So
Jan,
question, yeah, go ahead.
I apologize. I just wanted to let folks know, I believe I found the article that was written, so I put that in the chat for folks if they wanted to take a look.
Oh, great.
Mhm.
Great. Okay. But if anyone's willing to speak up, I mean, how would you use this? How could you use this in what you guys do?
I think for me, Jan, and in my role in particular, this would be mostly educational for me, but we do have CSRN, which is Cancer Screening Research Network, and I'd be curious to see if there are any avenues that are popping up for them that would benefit from using this at all? Not to pick on the other Victoria in the room.
No worries, Victoria. I was thinking, you mentioned like using this in a grant proposal. I think that would have been so useful, had this been around at the time of the grant proposal for CSRN. Right now, I'm trying to think of the ways that we could potentially incorporate it, but potentially for future studies.
Anyone else? And I'm constantly thinking about different data points we might want to bring in here, and I'm very familiar with the cancer registry data, which is very robust. We just have to figure out what would be important for researchers to pull that in. Someone yesterday at the executive meeting mentioned maybe more information on, we have a couple of environmental like Superfund sites. There's a researcher, Tintin Sue. That's another example, Lisa, actually. She used this to help do education, but her study is on contaminants in Pueblo in the soil due to some, not Superfund site, but some environmental toxic site, if you will, and how that might be altering DNA, so increasing cancer rates there. So that's a great example of one of our own team members that used ECCO for that purpose. But is there anything else we could add to that? Or facilities, so in terms of content, risk factors, or added facilities you might want to put on here too. Locations of things. I'm excited to look at the enrollment data. Just roughly, I did a quick analysis of it. About 12% of patients come from rural counties, which makes sense because about 12% of our population live there. So that's good. But we're going to actually try to visualize it here with a map. So I'll be excited for you guys to look at that as well.
Great. And Jen, as folks are, I think, playing around with the platform and getting familiar with it, if they do have feedback or suggestions, what's the best way to submit that? So I see like a feedback button on the bottom. I think there was a contact us at the top. How would you recommend folks share their questions and feedback?
Honestly, any of the above, Tim. They can
Okay.
email me directly. They can, I'm just going on this page right now, but
Sure.
they can email the COE website, which will get to me. Stop by my office. So
Great.
yeah, I mean, we built it and now we don't want it to be static. You know, the idea is to optimize the use and the content. So we welcome any and all ideas about what folks might want to add to this. So please feel free to contact me.
Fantastic. Okay. Well, we are just about at time, so thank you again for being here to present this information to everyone today. Just a reminder for those folks on the call, as you are exiting the Zoom meeting, there will be a survey that pops up, so please take a couple of minutes to fill that out and provide your feedback on today's Lunch and Learn. And we will see everybody at the next Lunch and Learn in December. So we'll stick on for a couple of minutes. But thank you again, everyone.
Bye. Thank you for having me.